Hello everyone, my name is Mihir Modi, Class A healthcare student. Today I would like to talk about the effectiveness of platelet-rich protein therapy in patient with knee joint osteoarthritis. Osteoarthritis is a chronic degenerative condition primarily affect the articular cartilage between knee joint between tibia and femur. This arthritic condition results in wear and tear and progressive loss of articular cartilage between knee joint. Platelet-rich protein therapy is a form of regenerative medicine which involves the extraction of the blood, centrifugation of the platelet, then injecting these platelet back into the affected area such as a knee joint. This injected platelet results in release of the protein that is called a growth factor. This growth factor inhibits the inflammation, reduces the friction between tibia and femur, and it also improves the joint function in patient with knee joint osteoarthritis. Previously, this PRP therapy was used in a hematological department, but nowadays it is used for the cosmetic procedure and musculoskeletal condition and sports injuries too. How does this PRP work in patient with knee osteoarthritis? So PRP therapy, platelet-rich protein therapy, inhibit the inflammation and it improves the joint function. Thus, it reduces the degenerative changes in patient with knee osteoarthritis. Secondly, it stimulates the formation of the new articular cartilage, which is situated between tibia and femur. It acts as a cushion, so it promotes the formation of the new articular cartilage. Thirdly, it increases the production of the lubricating fluid between tibia and femur, thus, it reduces the friction between tibia and femur. And the last one is that it contains the protein, platelet rich protein therapy. It contains the protein that alters the pain receptor, which results in the reduction of the pain sensation. So, these are all the mechanism on which the platelet rich protein therapy works. Now, what is the history of the platelet-rich protein therapy? How it was introduced in medical sector? So, in year 1970, hematologists created this term. Hematologists coined this term in hematological department. Previously, PRP therapy was used to treat a patient with thrombocytopenia. In year 1980, PRP started to be used for the maxillofacial surgery. In year 1987, PRP started to be used for the cardiopulmonary department. It started to be used in open heart surgery. In 2006, PRP started to be used for the cosmetic procedure to treat a patient with androgenetic alopecia, alopecia areata, and later on it started to be used for the musculoskeletal condition as well as for the sports injury. Now, what are the major steps in platelet-rich protein therapy? So, the first step is the extraction of the blood, patient own blood into the vial. Around 15 to 30 ml blood is collected into the vial. Second step is a process of centrifugation. In this process, the blood component undergo the spinning process. The spinning device physically separate the fluid liquid component and solid component. It separates the RBC, WBC, platelet, and plasma fluid. So this centrifuged platelet is now injected into the affected area, such as a knee joint, under the guidance of ultrasound probe. So these are all the steps in which under which the PRP process is performed. Now to diagnose, now to evaluate the effectiveness of platelet-rich protein therapy, one survey was conducted in orthopedic and traumatology unit of the University Local Hospital. Around 153 patients were enrolled in this study based on inclusion and exclusion criteria. The study period was between January 2018 to January 2020 for the pre and post operative therapy for the status of the pain, for the evaluation of the status of the pain, Womack scale, KSS scale, and visual analog scale was used. And for the radiographic study, for the radiographic imaging, X-rays and MRI were taken at the baseline and after the introduction and after the 6 months to evaluate the degenerative changes in the knee osteoarthritic patient. So they concluded that after the introduction of the platelet-rich protein therapy, the pain was reduced in a 1 month, and after the 6 month, the best results were obtained. The maximum result were obtained after a 6 month. So it showed that, and it found out that platelet-rich protein therapy is effective in patient with knee osteoarthritis.